The tech company Clean Air is here to focus the attention on a global serious problem, the air pollution. Air pollution is now the biggest environmental risk for early death, responsible for more than 7 million premature deaths each year caused by heart attacks, strokes, diabetes, and respiratory diseases. That's more than the deaths from AIDS, tuberculosis, and malaria combined worldwide. Children, the elderly, people with existing diseases, and ethnic minorities and low-income communities are particularly vulnerable to adverse health outcomes and economic impacts, such as missed workdays for health conditions caused by exposure to air pollution. Research suggests that long-term exposure to some pollutants increases the risk of emphysema more than smoking a pack of cigarettes every day. And recent studies show air pollution can impact mental health, worker productivity, and even stock market performance. To understand the best way to develop solutions, it's important to better understand this invisible threat. What we typically think of as air pollution is actually a mixture of small particles and harmful gases. The World Health Organization has provided evidence of links between exposure to air pollution and type 2 diabetes, obesity, systemic inflammation, Alzheimer's disease, and dementia. The International Agency for Research on Cancer has classified air pollution, in particular PM2.5, as a leading cause of cancer. Particulate matter, PM, is made up of small airborne particles like dust, soot, and drops of liquids. The majority of PM in urban areas is formed directly from burning of fossil fuels by power plants, road vehicles, non-road equipment, and industrial facilities. Other sources are dust, diesel emissions, and secondary particle formation from gases and vapors. A recent global review found that chronic exposure can affect every organ in the body, complicating and exacerbating existing health conditions. Latest estimates by the European Environment Agency show that fine particulate matter, PM2.5, continues to cause the most substantial health impacts. Under the European Green Deal's Zero Pollution Action Plan, the European Commission set the 2030 goal of reducing the number of premature deaths caused by PM2.5 by at least 55% compared with the 2005 levels. The European Commission initiated a revision of the ambient air quality directives, aiming to align the air quality standards more than closely with World Health Organization recommendations, which have been updated and tightened last month. How is the COVID-19 pandemic linked to the air pollution levels? The temporary reduction in human activities results in lower emissions of some air pollutants. Air quality data reported to the European Environmental Agency shows that concentration of nitrogen dioxide, a pollutant mainly emitted by road transport, decreased in April 2020 in many European cities, where lockdown measures had been implemented, with large variation among and within cities, relative to business as usual scenario. The largest fall in NO2 concentration, around 70%, was seen at traffic air monitoring stations in Spain and Italy. PM10 concentration also tended to be lower in April 2020 compared to business as usual scenario. The greatest relative reductions were estimated at traffic stations in Spain and Italy. Limited number of sites, mainly rural background stations, recorded increase in PM10 concentrations. There are two other relationships between air pollution and COVID-19. The possible effect of air pollution on vulnerability and susceptibility to COVID-19 via previous long-term exposure to air pollutants, and the possible role of air pollution in spreading the SARS-CoV-2 coronavirus. Some very recent studies, some produced in the early days of COVID-19 pandemic, have explored those links, and over time, World Health Organization guidelines have increased the importance of cleaner and less polluted indoor environments in reducing the spread of viruses and risk of infection. This is one of the reasons air purifiers are great, because they reduce concentration of pollutants and then risk of infection indoor. The role of air purification is very important in industry, in particular when applications at the point of source are not possible or sufficient. The purpose of having industrial air filtration equipment is to extract impurities out of the air that can cause health problems for the employees, quality of ambient air, or issues with the products being manufactured. Smoke, dust, and mist are the major contributors of common issues in an industrial facility. Lack of routine maintenance can cause equipment failure, machine shutdown, and loss of production. Depending on the type of dirty air being produced in a factory, sometimes the ambient air filters or source capture equipment cannot avoid completely air pollution. This means that additional purification intervention within the indoor spaces of the industrial facility before the air is released outside need to be implemented. A common mistake companies make is when they begin to grow and add machineries. Existing solution may become insufficient or not adequate to remove the excess of pollutants added to the air. Usually, new systems have a little bit of overhead, but over time that overhead gets eaten up and accidents starts to create problems. Having an industrial air filtration specialist figure out if your facility is set up properly is crucial to keeping your machinery running efficiently. Another big problem is that most common purification systems are based on filters, and those tend to get obstructed and reduce the air abatement rate performance over time, become also less efficient in energy usage. To help industry improve the air cleaning capabilities and increase efficiency of existing systems, tech company ES Clean Air Italia has developed an innovative filterless air pollution abatement (APA) system for industrial processes. Through its efficient method of cleaning and purifying ambient air, our APA technology lowers industry's emissions and carbon footprint. As anticipated before, traditional air purifiers usually consist of a filter or set of multiple filters and a fan that sucks in and circulates air. As air moves through the filters, pollutants and particles are captured, and the clean air is pushed back out into the living space. Typically, filters of particulate matter are made up of paper, fiber, or mesh, and they require regular replacement to maintain efficiency. Other types of filters may be required for gaseous and chemical pollutants captured. That means, in addition to the purchase price of an air purifier, industry should also factor in high operating costs and filter replacement costs, but the APA, air pollution abatement technology, is totally different and very innovative. In fact, APA technology uses only simple water and mechanical processes to reduce up to 99% of particulate matter and a wide range of chemical and gaseous pollutants in the air we all breathe. The APA technology, which has 24 patents granted in the main industrial countries of the world and a wide operational know-how, does not use filters nor chemicals. That means no special waste at all, and has been certified for the ability to remove nanoparticles up to 20 nanometers smaller dimension than SARS-CoV-2 coronavirus. APA technology is versatile, flexible, and highly scalable, applicable to a wide variety of environments, both for industrial application and in urban spaces. In addition, the application methodology cluster model distributed in the spaces of use has also been patented, which allows APA to be used with a number of modular installations depending on the customer needs, even in a large networks of air purification systems, both in indoor and outdoor environments. In addition to significantly reducing air pollution, bringing practical medium-long-term benefits for all stakeholders, the APA technology allows the reduction of energy consumed by the air treatment units placed at the service of buildings and at the same time eliminates and kills the viruses and bacteria present in the air together with dust, pollen and spores. This allows timely prevention of the risk of contamination, protect the users of the spaces treated and limit the spread of diseases that are transmitted by the air, thus significantly contributing to restoring confidence in the use of internal spaces, buildings, hotels, and all similar spaces, making them healthier and safer. APA therefore stands in these terms with the uniqueness of proposing itself as a triple-win solution, significantly differentiating from all other technologies in the sector. With no surprise, in fact, APA is recognized as a best available technology, BAT, for its action to reduce atmospheric pollution, a Class 1 medical certification as medical device for its ability to protect people's health, and as an efficient and profitable solution. For the latter, we are part of the Solar Impulse Foundation, labeled and member solution, achieving 100% positive technical evaluations by independent experts, as APA is fully sustainable and consistent with the principle and the paradigms of circular, social, environmental and governance economy, and with numerous relevant sustainable development goals, in accordance with the United Nations programs. APA guarantees a constant and effective abatement rate over time with the lowest cost for running and maintenance in comparison with other solutions which are present in the market, in terms of staff time, energy consumption, without filters replacement, etc. A comparative index made by third independent parties, the technology due diligence, has certified the superiority of APA in terms of performances, targeted pollutants, and other features. In addition to the pollution and CO2 abatement capacity of one single APA panel corresponds at least to 100 mature trees, and to achieve the APA abatement performance, nature requires 575 times more water. APA could be also integrated with existing solutions, improving their performances and reducing the energy costs. It is also important to underline that industry manages already water treatment system. For this reason, the APA solution does not cause further burdens, but is a very simple solution to apply and at the same time a working, effective and efficient system which can solve a problem that needs to be put an end immediately, and we have to do it together. Thanks.